Hi, hello, and welcome. Our conversation today is about the mind matters, mental health, and well-being. These are, of course, very, very unusual times. The coronavirus continues to surge in India, not as dramatically as it has maybe in other countries, but worrying nevertheless. Beyond coronavirus, a problem that we're all tackling with and trying to grapple with on a daily basis across the country, wherever you are, we're also tackling with something which is perhaps not so visible, and that's mental health. Over 200 million people are affected by some form of a mental health problem or the other. And much of this, until perhaps now, has remained hidden. And even today is not being discussed and spoken about in the manner that it should, and as critically that as it should. So let's talk about what are the key issues that are at play here when it comes to mental health as a broader challenge. Number one, let's talk about how you might be experiencing it and perhaps being exposed to it in your current existence, in whether you're as loneliness, isolation, or even depression. How has the whole lockdown phase, which is now 40 days plus in most parts of where we are in India, affected you and likely to affect you even going further? And finally, what can we do apart from accepting realization and acknowledging the problem to alleviate the problem and address it where we are, whether it's individuals, organizations, governments, business leaders, healthcare professionals. How can we individually, singly, or collectively respond to this challenge that clearly is has not just now come above into open evidence, but also now beginning to surge. So to do that, I'm joined by an excellent panel of guests who will share their own experiences and talk about what needs to be done. Let me welcome Dr. SHEKHAR SAXENA, Professor of Practice of Global Mental Health at Harvard H. Chan School of Public Health, previously Director of Mental Health and Substance Abuse at the World Health Organization. We're also joined by Dr. Malik, who was earlier an MBBS from India, then a specialist. He's done his specialist training in psychiatry in the United Kingdom and spent 13 years in the NHS, or the National Health System. He's also been with the Royal College of Psychiatry, then the European Board of Psychiatry, and also has an MBA from the London Business School. And finally, NEHA KIRPAL, who many of you may know as the founder of the first international art fair, who spent 10 years doing that and then sold it to MCH Basel. She is, like me, an Aspen fellow and also founder of an interesting new initiative, which is very timely and relevant to what we're going to talk about, called InnerHour, a digital platform that attempts to ease access to personalized self-help tools to support your mental health journey. Thank you all for joining me. The structure is that we've thought of is as follows: that each of you will speak for about 4 or 5 minutes on the outside to define the problem, the issues, and the challenges you see it. Post which we go into a conversation, and obviously a lot of that conversation is going to be based on Q&A from all of you who have attended it. Thank you all for joining in. My thanks to additional thanks to Ananta Aspen for inviting me to moderate this. So thank you all, and let me hand this over to you, Dr. Saxena.
Hello, good morning, and good afternoon, good evening, wherever you are watching, and thank you, Govind, for a very nice introduction to the topic that we are handling, and also introduction to me. Mental health problems have been in India and in our communities all the time. So it's not something new that we're talking about. In fact, mental health problems touch all of us in a variety of ways. We might have a mental health problem ourselves. It might be in our family. It might be in our colleagues, or we might be caring for somebody who has a mental health problem. And when I say mental health problem, I include anxiety, depression, which are very common. Also substance use problems like alcohol and drugs, but also in some cases, severe mental disorders like psychoses. But you're right that the COVID epidemic in India has actually brought it out into open, but also let's remember that it has also increased it. We do know from international studies that the prevalence of mental health problems increases almost 5 times during disasters like this. It can be a pandemic, which we are experiencing now, or it could be an earthquake or a tsunami or any other humanitarian disaster. And it affects our mental health in a variety of ways, and it increases the prevalence. While it increases the prevalence, it actually decreases the access to services, because the health infrastructure is no more as much functioning. So increased need and decreased access to care is something that we are seeing today in India as well as in many other countries. Some of the factors which are responsible for increasing this are, as you said, loneliness, not being able to be in social contact. And in fact, the phrase social distancing is actually a very misleading phrase, because what we need is physical distancing and a social connectedness. So that kind of communication should be exactly right and not misleading. And also economic problems like joblessness. Suddenly people are finding themselves isolated without a job, without any income, and also being at a different place than other family members. They might be stranded, and that all give rise to increased mental health problem. Now, lastly, you said, what can we do? And as a society, we can do a lot. We can just be more aware of the mental health issues and make sure that our policies and our actions are promoting mental health rather than to put more stress on it. As governments, we need to be spending more money and giving it more attention in the public health planning for COVID. In fact, there should be no governmental response for COVID without a mental health component. This is true for the federal government, but also for the state governments, and even down the line to the districts and municipal level. As business leaders and employers, we need to see to it that our employees, our staff are well looked after from the mental health side. And there are many mental health promoting activities that we can do, giving them clear messages, giving them support, and making sure that their mental health needs are looked after by the employer are something that we can do. Here, there is a need for leadership, which is very relevant for the Aspen Fellows. You are the leaders, and you need to see to it that mental health is part of a leadership campaign. And as civil society, we can help each other. We can garner some resources. We can make sure that the people who are vulnerable, people who are in high need, are looked after preferentially. And as health professionals, and I count myself as a health professional, we can make sure that health access to mental health care is available to everybody who needs it, in terms of promotion, in terms of prevention of mental disorders, as well as treatments if that is necessary. And during these times when physical access is difficult, digital mechanisms are a good answer. And a lot can be done by that. Mental health problems don't always need a professional who's highly trained. It can be given by a doctor, it can be given by a nurse, and it can be given by remote methods, which are becoming increasingly important. So a lot can be done, and we're looking forward to more action in India.
Thank you very much. May I hand it over to Dr. Malik?
Thank you, Govind, for the introduction, and thanks for the Aspen Ananta Center for inviting us to talk about this issue. So the first thing to really talk about is, I'm just chiming in with what SHEKHAR was saying there, that the concern that a lot of us who've been involved with the field for a very long time is not just a short-term concern, but what's happening to people psychologically today. Right, which is both in terms of the new cases that are emerging, and I can tell you lots of stories around those, but also around the existing individuals who had mental health difficulties in the past, either relapsing or having a worsening of their symptoms. But the other concern is, what is the medium to long-term sequelae of this, and how is this going to play out for individuals, in the medium and the long term? And just to add a bit more background, so I as you said, I've been a psychiatrist for about 13-14 years, and before I came back to India. And the purpose for coming back to India was to actually provide the ecosystem with a early access, an early intervention system where a lot of people can access mental health support compared to what was happening before. Right, so we built a digital platform over the last 4 years where almost 7 lakh people have taken assessments. We've had therapists now delivering therapy in almost 100 cities in India, both digitally. And the idea really is to actually, even in the pre-COVID times, how can we improve early access and interventions for individuals, as because Shekhar will agree hopefully that the earlier we intervene, the better the outcomes are, right? And that applies very much to this time, right? To COVID times, it really applies, because giving people the right tools, and there are specific groups you're very concerned about, and I'll come to that in a minute, but giving people the right tools to psychologically deal with not just the stress around health anxiety, but also OCD type symptoms that are emerging in people, to where some healthcare professionals are starting to display PTSD kind of symptoms. So giving people the right tools to cope with those symptoms right now will have a long-term benefit, not just for them, but their families and their wider ecosystems as well. Right. So, and there are specific groups, as I said, we are concerned about. Right. The first group we are really concerned about is healthcare workers. The impact of the current crisis on healthcare workers. Everybody knows about the practical impact of that in terms of going out there and facing the challenge day in and day out on our behalf. But more importantly, the psychological impact of it. And we've been starting to see this a bit on our platform as well. The fear, the health anxieties, the actual sense of helplessness sometimes, of not being able to help their patients, or concerns about their family members. All of these things are beginning to play out, and we're hearing some terrible, tragic stories of healthcare workers around the world that there are almost and they are now ended up taking their lives, not because of either the guilt or the depression that's followed the exposure to such extreme negative experiences, right? So that's one group we're very concerned about, and to that extent, we've been doing all we can to sort of make available specific programs for healthcare workers on our platform, and we partner with some large healthcare organizations and doing all we can to make that available. The second group we are concerned about is employees who are trying to make it work from home, right? Which sounds quite easy and relaxing at most times, but in this context, it's very, very hard, right? And the ability to strike the right balance between work commitments and family commitments, the ability to live through and plot through work demands while still looking after your child, and still worrying about how to manage things safely from a health perspective, managing health anxieties for yourself, for your parents, for your children. So managing those balances, some of us are living alone. So the loneliness that comes along with working from home, all of these challenges, and that's the second group that we are really concerned about. And then there's obviously the concerns around other frontline workers and challenges that they're experiencing, right? So I think it's critical that there is, as Shekhar said, at a policy level, but also at an intervention level, we think today about how we support these people today, give them the right tools and strategies, so that they have better psychological outcomes, at least in the medium to long term.
Thank you very much, Dr. Malik, and it's over to you, Neha.
Thank you, Govind. So I think I'm really grateful to the Ananta Aspen Center and you, Govind, and the panel to really come together to have this conversation, because while mental health belongs to everybody, mental illness is a 1 in 4 problem. And I think, the realization more and more is that it's about a mainstream understanding of the problem, a mainstream experiencing of the problem. And what we don't realize is that no matter where you are in the world, or what your socioeconomic strata is, or language or culture is, mental health problems are experienced in much the same way. And actually the solutioning is also very similar. And when it comes to mental health, all countries are developing countries. And so there is a lot of scientific development and innovation and important research that has come out of India. But there's also great platforms and services that are available. And some of the top global scientists today are, Dr. SHEKHAR Saxena, who's been with WHO for over a decade and now at Harvard. Dr. Malik, who's moved back and set up InnerHour 3-4 years ago, and I joined him last year. These are all great initiatives, and there's several sort of helplines for suicide and emergency care, and NGOs doing phenomenal work. So I think this is a time when we must recognize that while we might feel helpless, but helplessness doesn't mean hopelessness. And I come at it with a lot of sort of personal passion and commitment. I've spent, now I've spent over 3 decades dealing with extreme mental illness in my immediate family. And I can see the toll that it takes, the intergenerational toll that it takes, not just on the person suffering, but also on the caregivers and the support community. And equally, the idea of rehabilitation or feeling better is also the interdependence of all of this. So, gone are the times when you say that, you go see a doctor and you get a medicine and then everything's okay in a few years. The whole idea is for us to become more aware, for us to become more expressive. Firstly, to ourselves, right? What Amit was talking about, 7 lakh people took that assessment on InnerHour, is a function of people self-stigmatizing, right? It's not a sign of weakness. Sometimes there could be a clinical condition, right? And how do we really know when are we going through that transition from just simply sadness to actual depression, right? When did it become a clinical condition that we need either medication support or therapy support? Who is recognizing that in our families, in our workplaces, in our teachers and principals and support systems that we have? So it's a question of, how do we build an understanding even of what we're talking about, right? We all understand different physical illnesses. We know that there's a strong comorbidity between mental health and physical illnesses. So people who have hypertension, diabetes, cancer, other chronic illnesses are that much more susceptible. We know about postpartum depression. We know that India has, unfortunately, a student suicide every hour of every day. The suicide rate in India is rising where every other country is coming down. And we recognize that, while there's a suicide every 17 seconds, but there's an attempt in this country every 3 seconds. So if you think about that together with the access to digital media towards traumatic circumstances like COVID right now, and us being put into a situation where frustrations and anxieties amplify, it's really a battle that is a personal one for every individual, and a battle that you fight to try and protect and care for your family and your sphere of influence in your organizations. So with that, I think my message that I try and sort of follow for myself and also for those I'm interacting with is really saying, how can we make a difference? What can we do firstly for ourselves, right? How do we empower ourselves with an understanding, with some recognition of what's wrong? How do we recognize that, these are 100% treatable solutions? I mean, no matter how strong, we've gone through severe psychosis in the family and recognize that after 30 years of severe psychosis, today there's complete rehabilitation in my family. And, we've seen that as a live example of the worst kind of mental health issues. So whether you look at anxiety, depression, paranoia, psychosis, addictive behaviors, all of these, there is treatment, there are cures, and, we tend to waste, typically you take 4 to 6 years to get to your first sort of mental health treatment and support. But actually, the time that it takes to start the rehabilitation process is very short compared to what it took to get there. Right? So I would just encourage people to just be more aware for themselves and those around them, to think about what kind of policies and support frameworks that we can put in place to make those around us aware and create systems that support mental wellness, as well as a support system or an intervention system that prevents mental illness. And also look at what kind of rehabilitation, what kind of support services can exist in communities. So I, as a personal mission, decided to dedicate the rest of my life to this space and joined SHEKHAR and AMIT in setting up, in working through InnerHour and Librum. So that's my introduction.
Right. Thank you so much all for sharing your experiences and your thoughts, and particularly Neha for sharing your own journey with us, and candidly so. Let me come back to you, Dr. Saxena. So, there is a transition point, I think, that many people would try and want to understand, right? As you go from, let's say, loneliness to depression, or sadness to depression. And maybe there are things happening right now and have got accentuated at this point that we are either seeing the early symptoms of, or even maybe advanced symptoms of. So tell us, how do we look at this as families, as it's mostly families now around us, and try and spot these symptoms early? And then we'll talk about what we can do.
Govind, mental health is a spectrum. Some of us are in very good mental health. That doesn't mean that we will always be in good mental health. So it's a spectrum, but it's also a dynamic. And some of us have some predisposition for mental health problems, and some of us might have a mental health problem and disorder right now. Now, a disaster like this actually moves the whole curve towards worse mental health. The people who had very good mental health have slightly less good mental health now because they have apprehension, they have anxiety, and sometimes symptoms which can become more during this time because of loneliness, because of economic issues, and so on. And people who have an actual mental disorders to begin with feel worse because of accentuation of symptoms, but also lack of care. Because at this point of time, to contact the usual caregiver is so difficult. Now, you asked me a question about when do we start acting. I would say that we should start acting at every stage. If we are just apprehensive, we can take some steps to decrease that apprehension and involve ourselves in some positive things that we like, people that we like to be with, at least maintain a social contact, and indulge. In fact, this is a good time to indulge in some of the things that you always wanted to do and never had the time for. So these are all positive things which will improve our mental health. If we have some symptoms, we should take help. And help does not always mean a professional help. We can talk to somebody we trust. It can be a family member, it can be a priest, it can be a village leader, and derive some kind of consolation that we are not alone. Everybody is facing that. And just talking to somebody is helpful. If you have a symptom which is actually interfering with our life, we can take more professional help. And this could be by a non-specialized provider, a coach, a person, a buddy, a person who understands these things. And there are very scientifically proved evidences that these things all help. And if we have a real issue, then of course there is help from a psychologist or a psychiatrist. So for the entire spectrum, we need to be aware that we can get help and we should seek help and get it. I think we are going through the COVID crisis, which is an eye-opener for us to be more aware about the mental health issues. As the governments are struggling to flatten the curve of the infection and deaths, there is another curve that we need to flatten. That is the curve of mental illnesses and mental health problems. And better care that we take for them, we will be, as a society, coming out much stronger. And this is not for the time being, it's for a longish time. So investment by us ourselves, investment as a civil society, and investment as governments will be very cost effective, and it will have a very high rate of return, which we all need. So I think we all can do something.
Right. And is there I mean, it's almost like a layman's question, but is there a inverse correlation almost with the increase, or a direct correlation between the longer the lockdown and the rise? So you may be flattening the curve on with the virus, but the curve when it comes to mental health problems will keep rising as the lockdown period keeps extending, which it is going to, where I at least am in the city of Mumbai.
Absolutely. In fact, more socioeconomic restrictions, which is felt by people, more will be the mental health problem. Now, I'm not saying that that should be the only guidance for the governmental action, because government has a responsibility to decrease the rate of infection, decrease the rate of death. But the policies can be implemented in such a way that the mental health impact is decreased. That's what we need. So the mental health should be part of all policies for disaster management like this. And mental health should be a very strong component of that.
Right. Dr. Malik, and from your own experience as in treating people, where do you spot or have typically spotted either the warning signs or flags, and how would you relate those to us so that we all, or those of us who are watching this, can maybe take heed?
Sure. So I think the earliest sign that people start reporting is some reduction in functioning, right? When the daily functioning gets impacted, right? So our ability to function at what our baseline is the earliest sign of saying, if you're not able to function at your baseline, then you need to just stop and say, how are other things going in my life, right? How is my sleep? How is my appetite? How is my interaction with my family or my peers remotely? So the first thing to think about is, how is my functioning? Now, all of us have variable functioning from day to day. So I'm not saying that one day of poor functioning should really alert you, but if you start finding that the next over 2, 3, 4, 5 days, you're not able to function at what was your baseline for the last few weeks, then you should really start thinking about and looking at the rest of your day and the rest of your habits. So that's the first thing I'd say, right? The second thing I would definitely talk about, and our therapists talk about all the time to all our clients we're seeing right now, is to be kind to yourself. This is hard, right? This is what is happening right now is hard at multiple levels, and Shekhar alluded to a lot of that, right? So being kind to yourself and actually practicing gratitude for the things that are going well, and that would be different thing for different groups and stakeholders, is very, very critical in actually getting to this in a positive mind frame, right? So when you start finding that two things, one, you said you start finding that functioning is changing, and second, if you start finding that you're being unnecessarily hard on yourself, then you just step back and then start thinking, what could I do differently, right? So because a lot of things are emerging, and for different groups, different things are emerging, right? So
can you, Dr. Malik, can you illustrate a little bit? I mean, that's, I mean, I can understand what you're saying, and I'm sure most of our attendees and viewers do too. So, I mean, where do you feel people typically go harsh on themselves? Is it people who are, people who are either working for someone? If I'm an employer, am I kicking myself for something? Give us some examples. I think that people will understand.
Sure. So let's take employees for example, right? Employees have done phenomenally well, and employers. I want to talk a bit about employees in India in the last couple of months, how they've really stood up and sought support for their employees, right? Which has been so heartening to see. One small silver lining of this entire crisis is how employers have really stood up and said, we want to support our employees, right? So, and across the board. But what you're seeing with employers, so, and I can talk a bit more about that later, but what we are seeing with employees definitely is that a lot of them are not making enough time and giving themselves enough leeway to be able to adjust to this new normal, right? The expectation from themselves, almost maybe not even from organizations, is to be able to carry on functioning and delivering as you would have otherwise. So balance goes out of the window a bit, right? Lunch becomes 4 o'clock and dinner becomes 11 o'clock, and because I'm not able to understand that actually I have to also wash my vegetables that have just come in and need to be washed for 2 hours, and then the kitchen needs to be cleaned thoroughly, and I need to make sure that I've washed my hands and about 5 times and more than I would normally, and I'm not making allowances for that because I'm not traveling, so I should be able to just do the rest of it, right? So I've saved all this travel time. So that's an example of employees being harsh on themselves, and what that leads to then is a sense of lack of achievement, right? And that itself can start affecting self-esteem. That can start affecting how you're seeing yourself, and that can then be a trigger for other problems downstream. That's an example of what we're talking about, right?
Right. So you're saying be kind to yourself. Do not be harsh on yourself, and look at things in as much a gentle fashion as you can. Neha, can I bring you in here? How are you? I mean, how does this connect with you or relate to you?
Yeah, I think it's a function of boundaries, right? I don't think we've ever been forced to look at boundaries so strongly, whether it's at a relationship level, whether it is work and personal life, whether it is us negotiating our environments because we don't have a option around that anymore. And so, two things happen in this. People with existing issues or grief or trauma that has been buried tends to come out. Right. And so it's a time when you might be hit by waves of sadness and things, and you might not know where that's coming from. And isolation brings some of that on. Time and distance brings some of that on from others. But then there's also new anxieties, whether it's financial anxieties, health anxieties, anxieties for elderly. If you look at young people and students, right, the amount of time that they're spending trying to study on Zoom classes, and how difficult it is for schools and teachers today who have to manage their own lives and families in addition to managing a class full of students on new technology that nobody had time to prepare for. So I think two things have come out here as themes. One is that, we've been thrown into the deep end, and I don't know if we're psychologically prepared. We're focusing a lot on preparing for it physically around us, but mentally, I think we need to create allowance to actually prepare and actually reconcile, come to terms with it, and make strategies and plans for ourselves and our families. But also just looking at the longer term of that, and saying, because there will be a time when this lockdown will lift, when the COVID paranoia will end. But trauma, PTSD, we know that these are all things that are caused and stay. And so what are we doing for each of our constituents for that, whether it's education or corporate or healthcare workers or just in our families is what is very important at this stage.
Neha, how do these phases...
If I can just add...
Yeah, please go ahead.
To what you were asking, being kind to yourself and looking after your own mental health is actually being kind also to others who are around you. Because if you're yourself not feeling mentally at the best stage, your function will not be as effective. You will not be able to look after the physical and the mental health needs of others around you. So that's a good hook, because many people feel that looking after oneself is actually not quite the right thing to do at this point of time. It's right for yourself, it's right for others.
Right. So, Neha, how do you see, you deal with this issue, I mean, through the work that you're doing with your app, but also you have been working on this for some time. How does this play out in terms of gender, in terms of demographics?
Yeah.
From what you've seen around so far?
Sure. So I think overall, because historically mental health had a certain degree of stigma or a sense of shame or denial attached to it, or just lack of information and understanding, you find younger generations a lot more open, right? So today the age group that is school going at university levels, young working professionals are all up for therapy. They are on our app. We've got 600,000 people on our app from like 100 different cities in India. There are people who are seeking help and seeking solutions. So that's one thing to say about young people. And I think young people are educating their parents about mental health issues and encouraging them to get help. People are seeing issues in terms of addiction in the families, in older generations, or marital issues, or whatever it is, and there might be a mental health issue underlying that.
But Neha, we hear, I keep hearing, and I'm sure this is somewhat unscientific, that a lot more younger people today are suffering from or facing mental health issues. Now, is that true? And if not, why? Or if so, why?
So it's true, and it's exponentially growing. So if you look at it, on the one hand, 50% almost of mental health conditions could potentially be diagnosed in your teenage years. And so there's a great case to be made for intervening early, teachers, parents catching problems early. But it's true that if you look at digital addiction, if you look at the availability of drugs and alcohol, if you look at the kind of spending power that people have today, and just the lives that we lead, the nuclear families, the urbanization, modernization, all of that put together, and the competition, everybody's got to get 99.9, right, to get anywhere in general,
right,
whether it's work or education. We are creating a self-sabotage situation where we're producing, we want to be result and outcome oriented, and we're somewhere challenging the humanness that needs to remain, right? And that really is a big challenge for us to grapple with in the longer term. So today, I think someone mentioned that in the age group of 15 to 29, suicide is the second largest cause of death. Right? We've got to be worried as the youngest working population. We're seeing many more women seeking help, because you're seeing also domestic violence, domestic abuse. A lot of these are because of addictive behaviors and other issues. So it's just time to keep our eyes open in recognizing when something moved from being just for that moment to something that is now an ongoing problem, and that needs a clinical solution, that needs a psychological solution, and what kind of solution might be best for you. You might want to work on yourself. You can do things like the app, but you might want to talk to somebody. You might want to go get admitted to an inpatient center for some time. These are all options that exist today. And if we sort them out, I think we'd save ourselves a lot of time, energy, and give ourselves productive years back.
Right, and we're going to talk about the post-COVID world in a moment, and some of the questions are also alluding to that. But one point you made, and let me throw that to Dr. Malik, digital addiction, and what kind of impact is that has had on young, old, and is some of that maybe accelerating the problems of mental health or not?
So let me just add two more points what Neha was saying about, first of all, about the demographic itself, right? So two things are just to add two more points about the younger population first. One is really that more people and more millennials. We know this from data that more millennials are open to talking about their mental health, right? And they're more open to having conversations. And secondly, that as Neha said, mental illness onset is highest in the young adulthood years. So in the younger years, that's when the onset is highest in terms of mental health conditions and diseases, right? The third thing that's happening is that besides the fact that urbanization and all the other reasons that lead to higher prevalence, there's now more awareness. So that's also leading to more identification of problems, which might have existed in the past and never got identified. That's just to cap up that answer. Now, your question was digital addiction, right? So digital addiction is growing at every level right now, and it's growing in younger years, and it's not just and there's a lot of interesting data around how it impacts your mental health. Actually, there's numerical data around how it impacts your mental health in terms of how many hours of social media, for example, will lead to it makes it more likely you'll end up suffering from depression. So I think I can't remember the number exactly, but I think it's 6 hours of plus in a day of digital and social usage will lead to a higher incidence of depression in individuals.
And is this across ages? I mean, I'm sure any parent watching this would want to know. I mean, how long can I, rationally keep my child away from the screen or exposed to a screen?
I'm not going to give you a number, but typically what we always tell parents is know what your child is doing online. That's the first thing to do, right? More important than the time, it's very important to know what they're doing online and have that control. I know it's difficult sometimes and parents are hesitant about independence, but you need to know what a child is doing online, who are they engaging with, who are they talking to. That's one. Secondly, what are they actually doing in terms of, I mean, if you're doing a class or you're learning a new skill online, great, right? That doesn't so it's not online or usage that really harms you as much as the wrong kind of online usage, right? For example, the use of social media increasingly leads to a sense of incompleteness and failure in young people, right? Because everybody comes out and projects their best self online, and a younger impressionable minds then see that as the reality of other people and find themselves feeling inadequate in multiple ways. Right. So it's also very so just one very, very important distinction. Technology per se is not the problem. The wrong kind of excessive use. So being on Facebook for 6 hours a day is a disaster, right? Without doubt, right? But doing an online course right now for 5 hours a day is probably right. You have to be careful with the eyes and give them enough rest. But from a psychological perspective, that you're learning a new skills, that's absolutely fine, essentially.
Right. And I think it's a very critical point, as simple as it sounds, that you have to know what you're doing and what your children are doing. Okay, let me pick up some questions as well. And some of them are more sort of broader public health. Let me go to Dr. Saxena. Lakshay Yog says that we are talking mostly about white collar workers. The most affected ones are the poorest of the poor. Apart from giving them economic support, how can we plan a community response to provide psychosocial support so that we do not remain elite and class biased in our approach?
That's a very good question, a very important one for India. And based on my experience in many other countries and also in India to look after these kind of possible disasters, I think it's very important to focus on the social aspects and the economic aspects of this disaster. And the poorest people in India, especially also the migrant workers, are facing perhaps the maximum social issues, which are going to definitely have a major impact on their mental health. Now, there are obviously things that are being done which are directly impacting them in terms of income, in terms of where they are, in terms of even food security. Many of them do not have a good supply of food. And there, it's the government as well as the civil society which has a major role. The government needs to provide the basic amenities to everybody, because other than if they don't do it, the mental health impact is going to be much larger. And in fact, the lockdown could be over, but the workforce may not be in a situation to actually contribute to the economy. So that needs to be kept in mind, which is very important. The civil society is actually coming up very well. And I have heard stories from India about how they are providing food, providing a place to stay, and also in some cases now the transport, which is very necessary for them to join the families. But you asked what can they do, and there's a lot they can themselves do, because they are being in a group usually and providing support to each other during this time of distress is actually very effective. So a community strengthening of ties and talking to other people and providing what they need right now by face-to-face, still maintaining a physical distancing, but also through digital media. Fortunately, India has a lot of phones, and that can actually be very important at this point of time to provide the kind of social connectedness that we need. And this kind of assistance is very important. I also noticed a question, and Neha referred to that earlier, about the domestic violence and other violence issues, which are coming up a lot, because you are certainly forcing people to be together, and that sometimes leads to some irrational consequences and very self-destructive tendencies. And we need to keep our eyes open for violence of all kinds. It's not only physical violence, it's also mental violence and psychological violence that is becoming very apparent. Right. And again, it's a matter of keeping our eyes open, being alert, and providing immediate help.
Right. So a lot of questions have come, and I mean, I'm sure all of us would have been getting them elsewhere, is work from home and post work from home, because work from home as a concept is going to remain. Companies like TCS have said that they want to keep 75% of their staff in home or at home. And this is one company with over 400,000 people and only 25% in the office, and most of Indian IT, and therefore, or by extension, most of many other potentially remotely driven workplaces will follow that, or potentially remotely driven workplaces will follow that route. So work from home is going to be an issue, and that's sort of going to blend into this post-COVID world. And there's a question from Sally Dipankar who says, work from home is becoming frustrating, and rightly said by Dr. Malik, the lunch dinner cycles are shuffled. And there is another question from Pramod Sharma who says, who asks, how do you become resilient and control over pain, fear, and sufferings to come out from the post-COVID era, or the COVID-19 era? So, Dr. Malik, do you want to go first, and then?
Yeah, so I think the first thing is to accept that this is an, sorry, am I?
Yeah, you're fine.
So the first thing is to accept that this is an uncertain time, right? So that's the first thing, to accept that and validate that, right? So because a lot of our energy is often spent fighting that feeling of uncertainty. We as human beings are need security in life, a lot of energy. So that's the first thing, is to actually validate that it's okay to feel uncertain at this time. That's the first thing, right? That's the first thing I'd say. Right. The second is that there is all my view, and I think this is shared by a lot of people around me. This is already a new normal, and you already have adjusted. Right. This is not happening since yesterday. This has already been happening for 40 days. People have adjusted significantly. So sometimes stepping back and saying, how far have I come from 2 months ago to now? And have I not already adjusted a lot? So that's actually stopping back, giving yourself a pat on the back and saying, I have adjusted, right? And the other thing is that with anxiety and uncertainty, one thing that can really help is asking yourself, what can I control right now? Can I control the future? So if the answer is no, and the answer should be no for most of us, what can I then really control right now, right? Think of what parts of your lifestyle you enjoy. How can you incorporate that? I mean, what do you enjoy right now in the lockdown? What parts of your lifestyle do you enjoy? How can you start thinking about incorporating them in your life in the new normal as well, right?
What do you do, Dr. Malik? What's your own?
Sure. So I have now the healthiest I've been in the last 15 years. Okay. I've formed a routine. I stick to 5 meals a day, which I was never able to do when I was at work. So I have 5 meals a day. I have smaller meals. I exercise 4 times a week with a virtual trainer, and I'm literally down to my body weight from when I went to the UK the first time. So then that's really helped me center myself, right? So and then I try and do deep breathing for about 15 minutes in the morning when I first wake up. So those are things I'm doing to sort of center myself. And because it's as SHEKHAR probably vouch for it, we are as vulnerable to these challenges as the next person, right? So we're not protected from the challenges. So I've tried and taken some strategies. I've got a 6-year-old at home who's been the best adjuster of all of us in some ways, right? It's like nothing has changed. He's adjusted fully, but building a routine for him that is engaging enough for him, but doesn't scare him, right? So with children is very, very important that we don't scare them, because that will have long-term consequences. Having open, transparent conversations with them is very important.
Right. Okay. Great. Yeah. Neha, quickly, and then I'll take some more questions. Yeah, go ahead.
Yeah, I'd love to just add to that. If you look at kids, right, they are resilient, they are coping, they have adjusted to a new normal, they are not carrying the baggage, they don't have the fears, they don't have the uncertainty, they're not carrying the guilt. And if you think about, that's how we were all born, right? So at some point we have burdened ourselves and conditioned ourselves to think and process things in a certain way. So I think, this is also a time when we can learn from our children, and we're kind of going back to the root of our humanness, right? And there's a lot of goodness in that. People are sharing, people are interacting. So, yeah.
Right. So, Neha, let me throw this question to you as well. Prithvi Manaktala asks, if as head of the family, you have a feeling that someone in the family needs help to keep positive in life, but to tell a family member that such type of help is needed is extremely difficult. So I need advice on how to approach this.
Yeah, I mean, it is a difficult thing. And I suppose it's ultimately, you might say that it's each one coming to that realization on their own. But how you can do that without shaming somebody, without forcing somebody to accept it, with a degree of empathy and understanding and patience. And at the same time, making sure that you're not enabling also, that you're not sort of feeding into that behavior. So it's about boundaries. It's about recognizing, what your role is in the equation. And positively supporting, but not owning the process of recovery, and letting the person discover their own journey as well. So it's gentle nudges and prompts, and finding the support and pulling that in. Maybe sharing the number of helpline, doctors, support apps, services that they can access. But it's really building that understanding. Right. The actual intervention, I suppose, is each to his own.
Right. Do any of you want to come in on that, Dr. Saxena or Dr. Malik? On how do you tell a family member about, that they need to, take help and or really acknowledge this problem?
Shekhar is the most experienced of all of us, so I will let him have the last word on this one, definitely. But one thing I would definitely say, Shekhar answered that in the beginning of his intro, which is about normalizing this, right? So this is really about saying that this can happen to all of us. Right, this happens to all of us from time to time. The statistics are 1 in 4 people have mental health difficulties in their life, and so normalizing it, as Shekhar did right at the beginning of this conversation, is very, very important. Not making it sound scary and putting fear in people is the worst thing one can do in this scenario. But I'll let Shekhar have the last word on this, definitely.
Yeah, go ahead, Dr. Saxena.
Well, based on many years of my practice as a psychiatrist, actually in Delhi, in AIMS, I can tell you it's a very difficult issue, because many times people who have a mental health problem don't really realize that they have one and don't want to seek help. But as Neha said, it's patience, it's gentle persuasion that really helps, and also pointing out what they could have been doing, which they're not able to do now. And that opens people's eyes about how they could be utilizing the potential of what their existence much better. And actually, to the person who asked the question, my suggestion is that there could never be a better time than this to actually persuade people to take help, because all of us are experiencing problem. So actually, it's a time to decrease the stigma. Mm-hmm. The world cannot be and should not be divided into two groups of people, one who have a mental health issue and others who don't. All of us have issues. So I think this is actually a very good time to come back and say, we all need help. Let's all go and seek help of the kind that we need. And maybe somebody needs a little more, and that person might be the one.
Right. And I mean, not surprisingly, there are questions about food. Mannan asks, can functional foods like tulsi tea, rosemary, or intake of essential oils like vetiver, or taking a rosemary vetiver bath help? Are there any food habits or lifestyle habits that can help in early stages?
Well, I can say that there is no scientific evidence that they are to any extent having a direct impact on mental health. But come, if something gives you pleasure, go ahead and enjoy it.
Absolutely.
Okay. Neha, do you want to come in on that?
I really don't know about the food and the exercise, but yeah. So
okay, but I think Dr. Malik made a good point. I mean, you talked about your own regimen now, and you said that how this has brought more balance to your life, and presumably this a regimen, a sense of balance in our food intake. I mean, I'm being very general here, but I'm sure you want to add to that, Dr. Malik.
No, so I was just going to say that. See, I completely agree with Shekhar. There's no absolutely. I'm not aware of any scientific evidence for the impact of these things on your mental health and your mental state. But what we have been talking about really is that people should do things that are enjoyable to them. Right. They should do things that help them calm down, right? But not do anything in excess. and not the equilibrium of doing things in moderation, whatever it is, and that helps them calm down, helps them stay relaxed, is very, very important right now. So yeah, if a good herbal tea makes you relaxed, drink it. But if it's got caffeine and drink it after 6 o'clock at night, you won't be able to go back to sleep.
Right. Okay. Okay. Radhika Bharatram asks, and let me throw this back to you, Dr. Malik. At schools, as people who are either running schools or principals of schools or teachers, what should we do, or how should we prepare as we reopen to take care of these young adults?
See, the first step, I mean, some schools are doing fantastic work right now, right? So how schools have adapted, and I've been talking to not just my child's school, but also a bunch of other principals in Mumbai right now. They've adapted fantastically well, right? And one thing they've done really well is communicate. And I would encourage more of that as it happens. Communicating with the children, communicating with the parents, communicating with the teachers, and communicating with each other is critical right now, because the last thing you want to do is make kids feel scared. So that's the first thing. So communication, and open communication and transparent communication is very, very important. Second thing, which I'm sure good schools will do anyways, is to make sure that they protect the children and the teachers as they come out before the vaccine comes out, right? So that's just a practical thing that I'm sure schools do anyways. Third, start picking up on early signs, right? Work with professionals and start picking up on early signs of distress in children, because some of them would have experienced that in the last 3-4 months. Not everybody would have adjusted healthily. So if there's early signs of distress in the child or in the parent or in your teacher community, actually, then make sure you get them access to help early. And make sure and I keep saying this again and again: the earlier people access help, the better the outcomes are. So look for these signs, develop some hygiene around and protocols in your school systems to say, if in a child we see these 5 things, then we should really notify and get them help. If for teachers we see these 3 things, or if in a parent communication we're noticing this, then we should suggest something to them. So have a simple protocol with simple signs that allows you to identify things at a population level early, and then offer them the right kind of support with professionals very, very early on.
Right. So Harish Chandar asked, and one line, just let me add that question, one line, how can we manage teenage children? Neha, back to you.
So just to add to that, and maybe how you manage teenagers, younger or older children, is that schools are not infrastructure. Schools are central institutions that bring our communities together. And, as a very proud Sri Ram parent and fascinated by how the school is trying to cope with it, schools and those running it need to recognize that you remain a part of our lives as families, as communities, and for children. And so there's many ways, but I would really encourage to build support systems, not just for the children, but also for the parents and also for the teachers themselves, because the school needs support in order to support the universe that it is reaching out to.
Right. So comment from BK Agarwal. He says that faith is a big healer. If Tulsi, etc., gives comforting feeling, let them enjoy. An anonymous attendee asks, and we are running to the end of our conversation. We've got about 7 minutes more. He says, or she says, sometimes I feel frustrated at the end of the day, feel down, even though I'm actively engaged with office work. How do I cope with this frustration and disappointment? How do I come out of this quickly? I know that you've all addressed this in some way or the other, but I know that also I would acknowledge that this is a question that must be topmost on people's minds. So let's try and give it another stab. Dr. Malik?
I can begin to answer that. I think
Go ahead.
It's very important for all of us to take some time, maybe towards the end of the day, to analyze our day and see what we have achieved, what we started with, what we have not been able to achieve, and how we could do something better tomorrow. And focus not only on the negative things, but also on the positive things. Because I'm sure we have during the day fulfilled some of our responsibilities. We have helped somebody. And that kind of recollection of that is a very positive influence. Obviously, there are things that you could do better tomorrow, and making a realistic plan and implementing that will be very important. But once I have the floor, I just want to come back to what you asked earlier. This may be actually a time that we pause and think about what are the values in our lives. What do we really value more than others? And in some way, reconfigure our work and private life. In many of our lives for the last 20 years, there was never such a time that we could actually pause, sit, and think about how our lives is going. So we can take a little bit time out every day, but also now, once we have the time, to think about our life trajectory. our family's trajectory, what is important, what is not important, and in some way rebalance the whole thing, which is very important.
And let me add to that question, Dr. Saxena. So Arti Vig asks, we have such an immense body of spiritual traditions in India. Why is our mental health vocabulary so sanitized and separate or distinct from all things spiritual? And I mean, she goes on to ask, are we throwing the spiritual baby out with the political bathwater? But I think the question is, how do we maybe arm ourselves with our own spiritual traditions, and can we arm ourselves to address the larger challenge of mental health?
Well, I believe that people have different coping mechanisms and different support systems. And religion is a very important coping mechanism for a very large number of people, and it also provides support. Obviously, some parts of religion can actually be difficult to cope with also, but by and large, these are very positive influences. But it depends on what person values and what person finds helpful. And if that is so, spirituality and religion both can be very important during this time of stress.
If I could just add to that, I think it's really a question of belongingness, and what is it that gives us strength and comfort. Now, whether that is a spiritual anchor or a religious anchor or a psychotherapist is really each to his own. But I think the idea is that mental health is not, as Aarti rightly said, is not just a healthcare issue. It is a developmental issue, it's a civic issue, it affects everybody in many different ways. And so the idea of conversations like this is to really bridge build between all the different kinds of vocabularies and the way in which we all interpret the same problems and the way we look for solutioning around the same. And I think it's ultimately a hybrid solution of all of that.
Right.
Sometimes you need clinical support, but sometimes over and above that, in any case, you need the psychosocial support of communities, spirituality, friends, and whatever else that keeps you going.
Right. So we've run into the end. Let me get a last word from each of you, and let me start off with Dr. Malik. So what's the one thing that you are likely to do different as a mental health professional, as a human being, perhaps, in this post-coronavirus or post-COVID-19 era, as our lockouts lift and we try and return to normal lives?
I think, I'm just saying that's a very good question. Let me just think to that. I think one thing I definitely do is live my physical life differently, right? So, and that I think will have a huge impact on my mental health. So we know that healthier bodies have healthier minds, but I think I also want to be able to channelize the conversation that have started on mental health in the last 2 months and make sure that it translates into action, right? At an individual level, organizational level, at government level, we can somehow channelize all the energy that's coming into mental health right now and translate that into wider action is what I'd really want to be able to do sort of post-COVID.
Okay, thank you. Neha?
So I think, I'm using this time, and I would encourage everyone to look at addressing any kind of fears, any anxieties, any conditioning that they want to walk away from or try and transcend, and really not be bound by that, so that, in the time that lies ahead, you can reconstruct your life. And, sometimes surrendering and sort of taking it in the face is a way of really getting past something. So we have that opportunity now, and we can actually reconfigure our outlook to life and our outlook to our own inner self. Dr.
Saxena, last word.
I think the most important message for me is to invest more in our own mental health, being more aware, being more attentive, and seeking help whenever we feel it is necessary. We all need to do that.
Right. Thank you very much, all of you. These are unprecedented times, but unprecedented times also offer unprecedented opportunities to reflect, to look at our own lives, to spend times with our near and dear ones, to understand what they're going through, to help them constructively if they are facing perhaps the early signs of mental health problem or maybe even advanced. This is, as all our panelists have said, a new normal, and it's time we accept it. This is also a new normal in a new age. It's a digital age, and that has its own challenges. But adjusting to that, understanding it, maybe even harnessing it effectively, including to find solutions, as some of our entrepreneurs on this panel are doing, might be a great way to reconnect with the world at large and your own world and workplaces as we emerge from into this new world and into this new era, so to speak. On that note, thank you all for joining me and sharing your thoughts and experiences and your pledges on how life is going to be different and you are going to change in coming days and months. Thank you all, and thank you on the behalf of Ananta Aspen for joining us on this seminar, and hope to see you in future for other exciting ones. Thank you so much.
Thanks, Govind.
Thank you.